Hi, I'm Sue, student nurse. Nice to meet you again. So I just know that minus revisions equal forget and study plus revision equal remember, which is why I made this YouTube video to also revise my lessons and also educate others people as well. So if you feel free to like the video or comment down below if you want me to do other topics about health. And also if you want to curious about other health subjects, a topic, just comment down below and let me know any things that I can improve on. I would take that as a constructive improvement because I'm a student nurse, so lifelong development journey is important for me. And so without further ado, let's jump into the new topic is ulcerative colitis. And here, ulcerative colitis, this presentation aims to study the definition of ulcerative colitis, the pathophysiology, the symptoms, the risk factors, the diagnosis, the treatment, and preventative cares for against first ulcerative colitis. So first, we want to know what is the definition of ulcerative colitis. Ulcerative colitis is a chronic inflammatory bowel disease causing inflammation in the colon, ileum, and the rectum due to hyperactive of genetic immune system attacking lower gastrointestinal tract, leading to infection susceptibility, and it results in ulcer and bleeding during bowel movement. So what are the symptoms of ulcerative colitis? We know ulcerative colitis, it causes inflammation. So the symptoms involve fever, tachycardia or fast heartbeat, rectal bleeding, onset diarrhea, usually 10 to 20 times per day, or urgent bowels, bloody diarrhea, abdominal cramping, dehydration because of the diarrhea, loss of water, weight loss, and anemia, which is the loss of red blood cells because the fluid loss, dehydration, and inflammation trigger. So what is the pathophysiology of ulcerative colitis? Here, I want to show you that ulcerative colitis spreading pathway, it begins at the mucosal layer to the submucosal of colons and then spreading to the rectum, and then it spread to the sigmoid colon. So the pathophysiology of ulcerative colitis is when immune system becomes hyperactive, attacking its own digestive system, and then it ulcerates large intestine, the colon, and the rectum part. The inflammation begins at the colon's mucosal layer, specifically at the base scripts of Libocune in the retrosigmoidal area of the colon, and then it develops into hemorrhages, bleeding into the crypts. Abscesses and becomes necrotic and sludge the bowel's mucosal cells, causing protein loss. The inflammation spreads to the entire colon proximally, and it spread to the entire colon, and then it triggers mucosal destruction and bleeding, and it causes edema and post formation. This clinical manifestation narrow the colonic lumen and causes bowel obstruction in the colon. Pseudopolyps refer to the tongue-like projections that assemble polyps formation in the colon due to ulcerative repetitive episodes. So intestinal function is unable to absorb nutrient, causing weight loss, and the mucous surfaces prolong the duration of the colonic transitions. Then it causes diarrhea and lead to hypervolemia, low blood volume, and then dehydration and protein loss. So it begins to affect the mucosal layer of the colon to submucosal layer, and then spread to the rectum, and then sigmoid colon. The differences between the ulcerative colitis and Crohn's disease is that ulcerative colitis, it affects the inner lining of colon, but Crohn's disease, it affects the entire bowel wall. It's like from the mouth to the anus, but ulcerative colitis affects only the large intestine and small intestine. Both share similar inflammations effect that triggers the gastrointestinal tract and digestive system. So what are the risk factors? The risk factors of ulcerative colitis involves excessive fiber food and unhealthy diets like junk foods, physical inactivity, dehydration due to insufficient water intake, holding urgent fecalization when you feel like you need to poop or having stool urgent, you holding it prolonged, and then sexual risk behavior also a risk factor. Edema, stricture, and fibrosis can cause obstruction to the colon to later develop ulcerative colitis. Rare medication side effect also trigger ulcerative colitis. Bowel infection affected lower digestive tract, developing risk of ulcerative colitis and perforation. So what are the diagnosis of ulcerative colitis? Diagnosis of ulcerative colitis includes the pathology, the blood test. They call lactoferrin. It's the Again, blood test. I have to say blood test here. We observe the calprotectin and ESR, the to observe the infection level from the blood and to observe if there's a sign of anemia. And then fecal lactoferrin or fecal calprotectin biopsy is a stool test to collect the stool culture and under microscope and then to observe any inflammation or infection in the stool. And urinalysis is a urine collection pathology test again to observe any infection in the urine sample. Then radiology is the we have X-ray, CT abdomen scan, MRI, and intestinal ultrasound to capture the image of the large intestine to observe any inflammation that affect the colonic lumen wall. And then colonoscopy, laparoscopy, or flexible sigmoidoscopy. These are also diagnoses, and colonoscopy is a common diagnosis to observe insert the camera incision. Some part of the laparoscopy is also insert camera incision, so it to capture the image of the inner colon, and usually like a suppository insertion. And flexible sigmoidoscopy is specific to capture the sigmoid colon. And then consultation with gastroenterologist is also recommended for diagnosis. If you experience symptoms, these are the diagnoses. So what are the treatments? The treatments for ulcerative colitis includes medication for initial treatment, and surgery. The surgery include proctocolectomy, colorectal resurrections, and sigmoidal colectomy. So I would discuss about medication, specific medication, and one surgery in this presentation. The medication here we have sulfasalazine, if I pronounce it incorrect, sulfasalazine, xanthous kinase inhibitor, and biological agents. Those are initial medication to treat ulcerative colitis. So sulfasalazine is a drug which contains a combination of 5-salicylic acids, also known as a 5-ASA, and it contains the sulfapyridine ingredient. The 5-ASA molecule is the active component. It is dependent on the sulfapyridine to be metabolized to the intestine and achieve effective therapeutic level. The 5-ASA is a prostaglandin synthesis inhibitor, and when prostaglandins are major inflammatory chemical mediator, ulcerative colitis is due to inflammation. So inhibiting prostaglandin, the inflammatory response is also inhibited by the 5-ASA medication. Corticosteroid can stop bleeding pain, while opioid analgesic for pain relief, antibiotic prevent infection, antiemetic reduce nausea and vomiting, immunosuppressant suppress immune system, respond to allergy reaction, and antidepressant can improve psychological pain or distress. Some of these medications need to administer under specific circumstances with nursing consideration on drug interactions. And the next one is the surgery. I will talk about proctocolectomy. Proctocolectomy is a surgical procedure removing the entire colon and parts of the rectum for ulcerative colitis as recommended to lower the risk of colon cancer within 10 years of remission. The surgery involved two procedures, the ilio-anal pouch anastomosis, or known as J-pouch reconstruction, and ileostomy. So ilio-anal pouch anastomosis, J-pouch reconstruction surgery, J-pouch reconstruction that create a pouch, and it healing within 3 to 4 months. And then ileostomy procedure, create a stoma hole. The ileostomy procedure also can be temporary or permanent double lumen ileostomy. So it's done in within 2 to 3 months to allow the anal pouch surgery to heal and repair, and then place the colon back into the abdomen. So and it creates a stoma hole. It appears in pinkish color, moist and shiny, usually for gastro feeding. The stoma locate in the lower abdomen area, and it's painless. The stoma will be swollen in 6 to 8 weeks, changing the size and shape to fully dissolve, and it's painless. The stoma connects ileum to the open abdominal wall, and ileostomy procedure also have ileostomy pouching bags that attach external to the stoma hole to drain out digestive waste through the ileostomy tubes. And after the surgery, the stoma therapists and nurses will have patient to clean, empty, removing, applying, and dispose ostomy drainage bags for the patient. The nurses will care for patient injury management, pain management, patient education, and post-operative cares. And preventative cares for ulcerative colitis. So ulcerative colitis is commonly target the diet factor as a risk factor. So limit fiber food when spot ulcerative colitis symptoms. Replacing fiber food with low residue diet with high pectin intake to thicken stool and prevent diarrhea. Avoid smoking, food that causes gastric discomfort, avoiding sex and physical inactivity, and encourage hydration with sufficient water intakes. And these are basic preventative cares and stay hygiene and hydrating. And this is it for ulcerative colitis topic, and references available upon request. And thank you for watching to my video. If you like the video, give a like and subscribe to my channel for more. See you in the next one. Thank you so much. Bye.